The next group of presenters, you will see three presenters who are going to, in the variety of things that they'll be telling you about, actually demonstrate some of the wide variety of things that are going on out there in the field. And Matt's really right. I mean, it used to be the point where you could ask any one of those of us that were involved, is there a study about this or that? And we all knew because there were only like 5 studies going on. But there has become so much that it's impossible to keep track of it all, which is great. So our next speaker I'll introduce is Dr. Natalie Gukasyan. She is a psychiatrist, assistant professor at Johns Hopkins University School of Medicine. She serves as a medical director for the Johns Hopkins Center for Psychedelic Consciousness Research. After receiving her MD from Tulane University School of Medicine, she completed her internship and residency in psychiatry at Johns Hopkins. She went on to complete her postdoctoral fellowship with the Johns Hopkins Center for Psychedelic and Consciousness Research, where her work included a pilot study of psilocybin-assisted therapy for people with anorexia nervosa and involvement with other clinical trials employing psychedelic-assisted therapies. Dr. Gukasyan is also a clinician at the Johns Hopkins Bayview Community Psychiatry Program, serving patients with co-occurring mental illness and addictive disorders. Please welcome Dr. Natalie Gukasyan.
You guys hear me okay? I was told that the Madonna microphone was not preferred for people with curly hair, so this is why I have this. And I can barely see the screen here, but we'll try to make this work. So very pleased to be here. I think this is kind of a special conference for me. I was in the audience 10 years ago for my very first Horizons, essentially a baby with nothing but a dream. And now I'm up here on the other side of things, slightly less of a baby, but dreams do come true. So we'll get it going here. I don't even know what button to press here. The green one? It's gotta be, okay. So just some disclosures. I'm a co-investigator on a USONA Institute-funded study, and the funding for the other studies that I'm working on, including what I'm talking about today, comes from philanthropic support from these generous donors. So today I'll talk to you a little bit about anorexia, how psychedelics might fit into treatment for anorexia nervosa, and a little bit of an update, kind of a teaser about what's been going on with our pilot study that started in 2019, but obviously has been like a little bit delayed because of COVID. So anorexia is a behavioral disorder, emphasis on behavioral. It's characterized by caloric restriction, fear of gaining weight, disturbance in perception of weight or body shape, and it's got actually the highest mortality of any psychiatric illness. It's about 10%, and it's actually approaches 20% for lifetime mortality, so it's a pretty devastating condition. And it's got very high rates of comorbidity with other psychiatric disorders like depression, anxiety, OCD. Phenomenologically, it's actually kind of similar to addiction and anxiety in some ways. And to complicate things, it's also highly comorbid with physiological issues that are secondary to starvation, so things like cardiac issues, gastrointestinal issues, renal and liver dysfunction, things that make the whole clinical picture much, much harder to deal with. There's a lot that we still don't know about anorexia and how it starts and how it develops, but our best guess is that there's a host of factors that predispose a person, so things in the arena of genetic predispositions, psychological traits, trauma, family dynamics, those kinds of things, and of course societal influences about pressures for thinness. And all those things together kind of coalesce and are expressed in a setting, in a set of behavioral changes. So things like body dissatisfaction and excessive dieting. And then once that dieting gets to a certain point, there's actually another host of issues that perpetuate the disorder. I think it's kind of a common misconception that anorexia is really solely an issue related to a drive for thinness or societal pressures to look a certain way for women in particular. But it's actually possible to induce these kinds of behavioral issues in animals and rodent models. If you restrict the amount of time that a rodent has access to food, paradoxically, instead of resting and trying to conserve their calories, they'll spend more and more and more time on the wheel, and in many cases run themselves to death. And female rodents are actually more vulnerable to this. So it's a very complicated disorder that we're still learning a lot more about. And to tie this into a little bit about how psilocybin might be involved, in terms of biological mechanisms, there actually isn't a ton of great or convincing evidence for why this might work. In part, this is a little bit difficult to study in people with anorexia in terms of binding profiles and things like that, because there are a lot of structural and functional changes that happen in the brain secondary to just starvation itself. So if you refeed somebody and you scan their brain before and after, it's going to look a lot different, but it's not clear if that's related to the anorexia getting better versus just people being a little bit better nourished. So notwithstanding, there have been some studies that shown that binding at the 5-HT2A receptor, which is known to be important for psychedelic function, is different in women who are recovered from anorexia nervosa. And there's also mixed evidence about differences in 5-HT2A receptor promoter polymorphism, so the tendency of this kind of receptor to be expressed on a genetic level. So the standard kind of treatment for anorexia comes in two phases. The first part is weight restoration, and the second part is maintenance of that weight restoration, and relapse prevention. So no kind of psychotherapy in particular has been proven to be superior to any other kind. And in many cases, medication is kind of a second-line treatment. A lot of the research on pharmacotherapy interventions has been quite disappointing. Unfortunately, there's no treatment that's been known to actually definitively reduce the likelihood of relapse or to improve that weight restoration part of treatment. And sadly, up to 30 to 50% of people relapse, and so we're in dire need of treatments that work, especially for people who fail to respond to the kind of treatment that is usually offered. So in terms of what we know for psychedelics as they're used for people with anorexia nervosa, it's actually very, very limited. The earlier wave of research from the 40s to the 70s had maybe like one good case report. It was written in French and recently translated to English by colleagues in the UK. As well as just like a mention here and there of someone who happened to have anorexia in this big bulk case report kind of thing where it wasn't very informative. More recently, there have been some qualitative analyses of people's experiences who've completed like ayahuasca retreats and things like that, but that's also sort of included people with bulimia and other kinds of eating disorders, so it's a little bit more difficult to actually interpret. And similarly, there was a secondary analysis of a large survey showing that people with just general eating disorder diagnosis have improved well-being and reduced levels of depression secondary to or after their psychedelic experience. And so now, in an effort to improve on this, we are one of 3 sites that are currently running a pilot study. Every pilot is a little bit different. We're not affiliated with one another, but we talk to one another and we work together. So we really want to figure out whether this can actually play a part in improving the lives of people with anorexia, because we're in dire need of those kinds of improvements. In terms of why we think this might work, a little bit more specifically, again, so phenomenologically, there are a lot of similarities between what happens to a person with anorexia and with people with addiction or other kinds of conditions that seem to be improved by psychedelics. Maybe not the most robust argument, but it's possible that there's some transdiagnostic set of factors that could be improved by psychedelics. Less likely, but still possible, is that there's some direct or indirect, like biological effect that can actually improve it has something to do with the pathophysiology of anorexia, but it's much more mixed and much more difficult to actually say that's the case. In terms of other kinds of changes. So you might have heard the term quantum change. It was coined by William Miller, who's the guy who came up with motivational interviewing. And he kind of splits quantum change into two kinds of change, the mystical kinds and the insight kinds, and you might recognize those terms from the kinds of experiences that people report when they have psilocybin. So it might be that those kinds of experiences can come together and really make somebody reevaluate what they're doing and maybe what direction they want to go, and to really make those big steps before that they were not really likely to make in the past. And finally, it might improve some comorbid conditions, so depression, anxiety, and other addictions and other kinds of things that are also going on. So those are not exclusionary for our study. So what we think is going to happen, so we believe that this will be a safe intervention, that psilocybin is going to be associated with reduced depression and anxiety scores, that it'll be associated with improvements in quality of life, and we have a whole host of secondary outcomes that we're kind of looking at, including eating disorder severity, BMI, many, many other things, food preferences, things like that. And in terms of what I could tell you so far, so I can't tell you very much. It's still a study that's ongoing. But we have to very, very carefully screen our participants, in part due to some of those health issues that can come along with it. So cardiac issues in particular. In some cases, we might refer somebody to go see a cardiologist, just to make sure that they're safe. A lot of people have bradycardia or low heart rate. In terms of selecting the adjunctive therapy, we thought pretty hard about this, about what kind of psychotherapy would be optimal. We ended up landing on motivational enhancement therapy, which is kind of based on motivational interviewing, and the goal being to cue up some of the thoughts and feelings around the eating disorder to get people engaged in change talk on their way into and out of the treatment. And I'll say a little bit more about dose in a minute, actually. So here is the structure of our study. Initially, this has actually changed a little bit. So initially, we came to the review board and said, let's give people 4 weeks of preparation of weekly meetings, and then 2 sessions of psilocybin-assisted therapy about 2 weeks apart using fixed doses. Anecdotally, there was we knew that people would be less sensitive to psilocybin, but we hadn't actually proved it, so we tried to go with the higher doses there. In the first round of participants who we worked with, we actually saw that that was true, and even at 20 and 25 milligrams, they didn't quite respond as we thought they did. So we went back to the review board and said, let us give higher doses and let us give more. So now we actually give up to 4 doses, with the last 2 being higher doses and being spaced even further apart. And the thing I can tell you so far, some people with anorexia tend to have these lower effects, and we can't really predict who would have those effects and who's actually more likely to not respond. People with anorexia, in part due to their co-occurring conditions, might require higher levels of support. And overall, change takes time, so even for people who have the kinds of positive experiences that we were hoping they would have, it's not something where you wake up the next day and you're not depressed anymore. It's that you're, essentially you have to make those steps to make the changes that were very difficult for you over the course of months. So it's a lot of work for people, and they need a lot of support while they do it. So I remain cautiously optimistic, and happy to tell you more in the Q&A. So you can find out more about our stuff here. You could apply. We're still recruiting. If you have patients with anorexia who might be interested, send them our way. And thank you.